Welcome to the Aging Better podcast brought to you by Jazda Care. I'm your host, Evan, and in this podcast, we're looking at all things aging and especially living well.
My name's John Riley and I'm an aged care physiotherapist, been working in the industry for over 30 years, and our podcast is all about longevity and quality of life.
So let's explore how we can age better together.
Welcome.
All right, we're back. And we're very excited to be continuing. We have our amazing guest with us, Lauren Dewsbury, who is a cognitive neuroscientist, and she's been talking to us all things about dementia. And we're very excited to continue that discussion. In our last one, in our last episode, we talked about, what it is and some of the impacts and, some of the treatments. But we're going to talk a little bit more today. Our goal is to help people alleviate some of the fears that they have. And, we want to help people.
We want to help people, and, it can appear a bleak kind of topic to talk about if you've experienced this in your life or in your work or in your family. It's a challenging area. And it can affect so many things, family relationships, and, every aspect of lifestyle. And as we said, it's a very large it's the number one killer of women in Australia, and it's getting closer for men also as people age and their lifespan increases. Longevity is increasing. This is a kind of a byproduct of that. But there's some very good news, and the good news is that prevention is very significant. Lauren said up to 50% or even more of all dementia is preventable, which is fantastic news, and it's preventable by our lifestyle, not necessarily by medications and relying on drugs.
So we're going to get there, but I want to talk a little bit about what does it mean day to day for a person that is a sufferer, and also for the people that are impacted by it. There are two different people that are sufferers in relation to the issue of dementia. The first is the person that is suffering from it, but then also the family, the loved ones, the carers, the staff, the people that are working with them. So the first thing is what impact does dementia have on a person that's living with it day to day?
It has a really big impact on both the person and the people around them that love them. And my experience with dementia came when my grandfather had dementia, and I saw the way that it impacted him. He went from this vivacious, opinionated, vibrant man into a really withdrawn version of himself. The difficult thing about dementia is that it not only it impacts memory and thinking and cognition, which then has this flow-on effect to functionality, and for a person to be able to just engage in the everyday activities of living. And so the things that we take for granted, going down to the supermarket and buying some groceries, pulling something off the shelf and opening it, planning, remembering where you put something. And that can feel really frightening and isolating. And to be a person caring or loving somebody with dementia is also really difficult. Caregiver burden is something that's not spoken about very often. And it has a really big impact on families. It can cause a lot of stress, mental health challenges, physical stress, fatigue, burnout, and also there's financial impacts as well. And one thing that was really challenging personally was the idea of grieving that person. You really grieve them twice. You grieve them when you realize that you can no longer engage and converse with them in the way that you once were able to. And then, of course, you grieve them again when they're not with you physically anymore. But it's just, it's really difficult for everybody.
Very challenging. I think one of the most heartbreaking situations I saw working in residential aged care was a couple who had come in early onset dementia. I think though the young lady was in her early 60s, and they just retired they had hopes and dreams, worked hard all their life, had so many plans, but within a 6-month period, she became unable to be cared for at home, non-communicative. The one thing they could do, which the husband was very grateful, was that they could go for walks. She kept her mobility, and they could go for walks, but that was all they had for many months. And you think, wow, it's thankfully that's not as common as, I guess, the regular Alzheimer's, and it's coming on at a later age. But you did say, some of the early diagnoses are coming in at around about an average of 65 years old.
Even earlier.
Which is tragic if you're going to live, our average ages were well into the 80s now. I think that's, heading towards mid-80s to 90s in the next period of time. So, comment.
Yeah, well, we do work so hard with this grand vision of what our later years are going to look like. And oftentimes they don't quite look like that.
Yeah.
And I think that's a really motivating way to think about all of these different strategies that we'll talk about shortly is how do I want my last decades to look like? Yeah. Do I want to be in an aged care facility, or do I want my independence? Do I still want to be able to engage with my grandchildren, go for a walk down the beach, be able to do the groceries on my own, go and see my friend for a coffee and maintain that social connection? Or do I want to be bedridden or in a facility, which is important because they're going to give you the care that you need? Yeah, having the vision for yourself of what do I want my last decades to look like, and then work backwards from there in what do you need to do to make sure that you can execute on that.
That's good.
So, you're researching in this area, you're reading about it all the time. It's documented in so many places that we have an aging population.
Yes.
What does this mean for society as a whole? Let's talk. We're in Australia. In an Australian context, what sort of impact is dementia going to have on our society moving forward?
We are in an aging population globally, and as dementia prevalence increases, which it is, the projections are that by the year 2050, 150 million people will be living with dementia, which is not insignificant.
Wow.
Yeah.
Yeah.
So, of course, that has really big flow-on effect to society as a whole. We need to consider the financial impact of that. Right now, dementia costs Australia $15 billion annually.
Wow.
And we also need to consider the impacts to healthcare. And John, you would see this in what you do, but as dementia prevalence increases, this is going to put quite a significant strain on the healthcare system because dementia patients require a lot of care and they often have quite complex comorbidities or other diseases going on that needs quite specialized care. And I think we already are challenged with resources in healthcare at the moment, and that's only going to get worse. And caregiver burden will also increase. So there's a lot to consider. There's a lot of impact to society as a whole as dementia increases.
You said the magic words there, comorbidity. John loves that phrase.
Love that
multiple comorbidities is his favorite.
Yeah, multiple. Yeah.
Can you explain what that means? Explain that.
Although I've said it a lot, clearly I haven't got it across. But I think Lauren's going to do a fantastic job.
Let's double click on that. A comorbidity you can think about is a disease that coexists or is related to that disease. So let me give you an example. Diabetes is a really strong risk factor for dementia and is often a comorbidity for dementia because blood sugar regulation impacts the brain and the brain's ability to use glucose for energy changes with dementia.
Wow.
So we could then say that diabetes is a comorbidity to dementia. Same as things like heart disease, often obesity as well. And interestingly, all of those factors are actually risk factors for dementia. So you can see that it becomes quite an interrelated web of different things that are feeding in and also worsening each other that all need to be treated.
That was very good.
Yeah.
That was heaps better than.
See, that's why we brought in the big guns.
That's exactly why. In residential aged care, the two biggies of why people come into residential aged care is falls and dementia, and often a mix of both. And again, they feed off one another. They're both safety issues. Sometimes people might be quite good on their feet, but they wander, and it's hard to keep 24 hours eyes on someone for 24 hours a day at home, even if there's a one primary caregiver and assisted professionals coming to the home. So quite a big challenge, but it's often a mix of both of those things. A person's mobility deteriorates, a person's cognitive side deteriorates, and it's like a double whammy.
Yeah, which also is a nice little teaser for the importance of exercise that I know we will speak to a little bit later.
Yeah.
So I heard of a situation recently where someone was functioning quite well. They had I think it was pneumonia. They went into hospital with pneumonia and then basically came out with pretty much full-blown dementia, almost like just quickly. Came on really suddenly. Like my understanding was that dementia was something that lingered or crept up. Like, is there something that can trigger, instant change or, very sudden change?
There can be, and potentially because there was immune system involvement with pneumonia, it might have triggered a neuroinflammatory state in the brain that could have acted as the catalyst for that. Often there can be situations where a spouse might lose their loved one and become quite depressed, and that can be the catalyst for quite an accelerated onset of dementia as well. That was what happened in my experience with my grandfather. So there are instances where perhaps the pathology is already there and there's an instigating event that just accelerates that onset, which changes the usual course of that slow, insidious onset that we spoke about before.
Infections are a thing as well. In our world, UTIs very commonly lead to, changes and very rapid changes in cognition. And thankfully, if you treat the UTI, that cognition can improve as well. But sometimes it's a step. It's a step, further into the disease process. What a challenge.
Yes. Yeah.
So we've pretty much identified that this is not a significant problem. This is a huge problem.
Massive.
That is potentially becoming an even bigger problem in the future as the population ages, as, even though there's been a number of attempts to medically look at, ways to bring out treatment. But your area in particular of speciality is how to treat this before it's a problem. What are lifestyle changes that we can make? What are the most exciting breakthroughs that you're seeing in relation to prevention of dementia as opposed to treatment of dementia?
That's a great question. And there are some exciting medical breakthroughs. Yeah. So they're particularly in the space of blood biomarkers and diagnostics, because from a diagnostic perspective, if we can identify the disease earlier on in the spectrum, we can initiate treatment faster. And even if it's not prevention, maybe we can slow that onset and give people more years that are
Quality of life.
Quality of life.
Yeah.
So there is a blood test that is testing for a particular protein called beta amyloid. And this is a hallmark protein that we see in the brains of people with Alzheimer's disease.
Wow.
It accumulates in the brain and it impacts how it can cause neuronal death, but it also impacts how brain cells are able to communicate with each other and causes this environment of inflammation and oxidative stress. So a new blood test to identify that in the brain is emerging. We're also seeing diagnostics around retinal diagnostics where they're looking into the eye to identify signs of Alzheimer's early. And then I think AI and digital technologies is going to become increasingly more important. And I'm excited for the advent where, biotechnology is going and these new treatments. I do feel confident in medicine, but I also feel very strongly that it's not going to be the answer. And from a lifestyle standpoint, there's some really exciting research confirming what I think we know, but the importance of exercise, particularly resistance training and aerobic style training for reducing risk and supporting cognition well into later decades. Even some studies have shown that those that have really that engage in high impact in exercise quite often. This was a study in women were able to reduce their risk by 88%. So this is really meaningful numbers. It's not just a couple of percent here and there. It's really, really significant.
Wow. Good to know.
And I'm loving that you said AI because up until then, I just thought AI was going to mean that I one day had to fight a robot. But now I know that there are actually very practical uses.
Some good elements.
There you go.
Yeah.
I'm glad.
Yeah.
I was worried about Skynet, but now, I'm not as worried.
It still could mean that, Evan, but it could also mean that our drug discovery process is accelerated and we see some treatments come a lot faster that we can
we'll be
use.
fighting with our full cognitive capabilities.
That's it, yeah.
Exactly.
Yeah, don't worry about satellites attacking us just yet.
Yeah.
But, let's use this. Anyway, we are heading to the end of this episode. But the great news is that we have some really exciting stuff coming up. We have Lauren's going to be back and we're going to be talking about lifestyle factors and a number of that. And you've done a lot of research on this. And so we're really excited to hear it. And it's right up John's alley as well. He's loving this stuff. So,
absolutely.
So,
hey, if people have questions,
yes,
we want to promote the discussion here. So what should they do? Some people may have had personal experiences or they've got fears or they read an article or something. What are they going to do?
Jump on and comment. Underneath these videos, comments are open and available. We want to have a discussion with you about this. It's not just, us talking to you. We want this to spark conversation for you to go and research, for you to go and read articles as well. We'll put some articles, in the link underneath so you can go and do some reading for yourself. I think that's
very good. Thank you, Lauren, for today. Very good.
Thank you.
Looking forward to the next one.
We'll be back.
Well, that's a wrap for this episode of the Aging Better podcast. If you enjoyed it, don't forget to like, subscribe, comment, follow us, and share it with someone. I'm John Riley. Thank you.